Hi Leo, thanks for your questions and concerns about my platform. I wanted to address them in a video response as well as the comment that I posted. I also have a couple questions for you about your platform, which will be at the end of this. Starting with salary caps. You said that an increase of 25% in general practitioner salary caps isn't a reasonable solution because Ontario and Quebec have already lifted the salary caps. My understanding of this is that it's a temporary solution and it's obviously only increasing doctors in Ontario and Quebec. My solution of a salary cap increase would be a long-term solution and it would affect every single province. You also said that you don't think that Canadian doctors moving to the United States of America is really a problem in our doctor shortage, and you quoted 1 in 9 Canadian doctors practicing in the United States of America. I don't understand how that's not a significant number, to be honest. 1 in 9 Canadian doctors practicing in the US, that's over 10% of our doctors. That's a significant number considering that we don't even have enough general practitioners to serve our own population. I do agree that we need more spots in medical schools. In Ontario there was 842 slots in 2009 for medical school students. I agree that that number needs to be increased. But I think that it's important that we address some of the other issues, like losing doctors to other countries, before we start investing in that, because it seems almost redundant to invest and open up extra medical school seats only to have those doctors pack up and practice in a different country. So I agree it needs to be addressed, and I think that it is one of many components in our doctor shortage, but I definitely don't believe it's the only one. You also mentioned about my figures being wrong for average doctor wages. I just wanted to point out that my figures were based on the average family doctor, not doctors in general, because let's face it, specialists make a lot more money than general practitioners, and we're having a problem with holding on to our family doctors, not our specialists. And those averages were also done before the salary cap lift in Ontario and Quebec, since this is only temporary. The $100 in extra funding for additional services not covered by our current healthcare system, this wouldn't just be like homeopathic medicine, which I agree that there's a lot of controversy around, although with the placebo effect, it can have benefits. This is from everything from like optometry, chiropractors, like everything that's currently not covered, which is a really, really broad scope. And it's up to the provinces how they would spend that money. For instance, if a province just wanted to include optometry in that $100 of extra funding, that would be their decision, because healthcare is pretty much administered by the province. So as a federal government, I don't really think that I could stipulate it has to be spent on this, this, and that. Rather just that it would have to be something that's not currently covered. I also disagree that it would cause the drastic increase in the healthcare budget that you suggested. You have to remember that not everybody is going to take advantage of this extra funding, so you're going to have like a carrying over of funds every year. You also have to keep in mind that reallocating funding to a certain extent, for instance, capping what hospital administrators make and regulating that, which will put some more money back into the system that could, for instance, go towards this $100 of extra funding. And I also propose that we switch some of our focus onto preventative medicine, which in my belief will completely, it'll save us so much money if we focus more on preventative medicine, bottom line. And I think that the money that we'll save if we have a stronger emphasis on preventative medicine would be able to be reinvested into this $100 proposal. So it's not like this $100 per person has to come, out of the current budget or in addition to the current budget, but rather some of it could be reallocated from funding that's currently being provided by the government. So hopefully I cleared up some of those issues. However, feel free to, fire back some more questions. And I do have a few questions for you about your video and your platform. I thought you had a great video. You're an incredibly inspirational speaker. I completely agree that discrimination is definitely a problem in Canada. I agree that we need to come together as a nation. but I was disappointed by the lack of tangible solutions in your video. In fact, the only real solution you actually proposed in the video was turning towards our Hispanic and our Aboriginal and our African American, etc. communities for solutions. But you didn't really say, what solutions or what problems that would address, so I would love it if you would clarify. In your follow-up comments, you said that you would propose $1,000 a year minimum in funding for every high school student in return for community service. I have two questions about this. First of all, where is this money going to come from? There are a lot of high school students in Canada, and to propose $1,000 a year, which you said would work out to a minimum of $4,000 a year upon graduation because they need a minimum of 40 community service hours. That works into $100 an hour for community service. That's a phenomenal amount of money, and I'm just wondering where you would come up with that money. My second issue with it is that I disagree with paying people for community service. The very definition of volunteering, in my opinion at least, and as far as I knew, was that it's not paid. You do it because you believe in it, or you do it for whatever reason, but you aren't given financial compensation for it. So I'm just wondering if you think that you'll be sending the wrong message to high school kids by paying them for community service. So if you could get back to me on that, that'd be great. And finally, the only other solution I could find in your platform was the development of a national youth council where youth leaders would provide suggestions on policy issues that affect young people. I was just wondering if you could elaborate a little bit more on this. I think it's a great incentive. I was just wondering, how exactly it would work. You mentioned that there would be an annual meeting. Where would this meeting take place, and how would youth leaders be selected, and how would they actually interact with the government to implement some of these changes and suggestions that do affect youth? I think that's it for now. Once again, thanks for the comments, and I thought you had a great video, and I'm looking forward to your response. Thanks.